Today is 14th November. The first thing that strikes our mind on hearing this date is the birthday of legendary scientist Sir Frederick Banting, who, along with Charles Best, discovered insulin in year 1922. In his memory, International Diabetic Federation and World Health Organization celebrates this day as World Diabetes Day. Incidentally, this year 2022 also celebrates 100 years of the discovery of insulin. Theme for World Diabetes Day 2022 is Access to Diabetes Education, which is a subset of the larger multi-year theme for the year 2021 to 2023, that is Access to Diabetes Care. Diabetes mellitus is a chronic disorder affecting more than 500 billion people in the world, and the prevalence has almost doubled over the last 3 decades. Diabetes mellitus is the leading cause of heart attack, stroke, kidney disease, blindness, and lower limb amputations. And India is said to be the diabetes capital of the world. Diabetes can be classified as type 1 diabetes, type 2 diabetes, gestational diabetes, as well as various other specific type of diabetes. However, the major chunk of the global morbidity caused by complications as well as mortality is by type 2 diabetes. Over the years, there have been number of life-changing technological advances in diabetes like continuous glucose monitoring and insulin pumps, which can result in better health outcomes as well as reduced hospitalizations, especially in patients with type 1 diabetes and patients with diabetic gastroparesis. Also, number of technological advances are coming up using artificial intelligence, like that of using it for the screening and diagnosis of diabetic retinopathy. However, even after so much advances, the access to basic mass diabetic education and care is far from satisfactory, not just in the remote-most areas, but also in the well-developed affluent societies. Hence, I would like to briefly highlight few important points about diabetes education. A person can have type 2 diabetes without actually realizing that he or she has it and can remain asymptomatic for a very long duration before the diagnosis. A person may have increased risk of developing diabetes just by the mere presence of risk factors like his or her age more than 40, having a close relative like a brother, sister, or a parent who has diabetes, being a smoker, being overweight or obese, or harboring associated comorbidities like hypertension and ischemic heart disease. The early subtle signs of harboring diabetes may include feeling very tired, losing weight without even trying to, increased hunger and thirst, increased frequency of urination, especially at night, slower healing of cuts and wounds, blurring of vision, increased and recurrent infections, especially in the genitourinary areas. To a diabetic patient, the main education to be provided is to accept the fact to live with diabetes forever. Essentially, the management of diabetes is more than 90% of 24 by 7 self-care. Hence, the patient can be the guide to his or her own treatment. Treating diabetes is not just treating sugars. It essentially involves prevention of diabetes related complications or picking the complications and treating them early. Management of diabetes is essentially patient-centric, with the patient being an active participant of the team by following a healthy lifestyle, going for timely and regular checkups as advised by the doctor, like that of blood sugars, HbA1c, kidney reports, cholesterol, blood pressure, eye checkup, and food checkup, over and above regularly taking the treatment as advised by the doctor. A healthy lifestyle for a diabetic patient may include sticking to a well-balanced diet plan, taking adequate sleep of about 7 to 8 hours, quitting smoking, avoiding processed and packaged food, at least 30 minutes of exercise daily, limiting the free sugar intake, and last but not the least, strict adherence to the medications exactly as advised by your doctor. This World Diabetes Day, let us all join hands in spreading awareness about basic diabetic education as far as we can and help in building a diabetes friendly society. Thank you.